Stakeholders in the health sector and civil society groups have jointly called upon the federal government and philanthropists to pay attention to the escalating burden of neurological healthcare emergencies in the country. Highlighting the pressing issues in a news briefing, consultant, neurosurgeon and chairman of the Nigerian Medical Association FCT chapter, Dr. Charles Ugwanyi, emphasized the necessity for realistic steps to tackle healthcare challenges across various medical specialties, aiming to improve the overall well-being of citizens.
If we are grappling with primary healthcare, what happens at the secondary, tertiary? The equipment, resources, both human, material, equipment, resources required to provide a decent, healthy neurological care is so much that a government that is struggling with primary and secondary health will be unlikely to provide those equipment. And I'm going to be very specific. Let us start from here in the FCT, and I want the Honorable Minister of Health to hear health, and also the Honorable Minister of FCT to hear me. Send this message out there. We have 14 district hospitals here in the FCT. I do not understand, and we do not understand in the NMA, why the patient will suffer a traumatic brain injury at Kubwa Express Road, down the road there, and is taken to the nearest hospital, Kubwa District Hospital, and we cannot get a CT scan. That patient is transferred unconscious to National Hospital. That is overfill up. These facilities in National Hospital cannot cope with 6 million people plus, 6 million plus people here in the FCT.
Addressing the media, the founder of the Brain and Spine Foundation Africa, Ms. Chika Okwolisa, harped on the critical role of public awareness in combating health crises. She pointed out that these crises are intricately linked to the prevailing economic hardships faced by Nigerians.
Regrettably, our hospitals grapple with a disconcerting vacuum as a considerable number of healthcare professionals, particularly nurses and doctors, opt to relocate abroad. This mass exodus leaves over 200 million Nigerians at the mercy of a depleted healthcare workforce. This situation translates into a heavy workload for many physicians, especially as more are packing their bags even as we speak. There are hundreds of unnecessary and avoidable deaths happening daily, especially from neurological emergencies.
A Nigerian health sector reform advocate, Dr. Douglas Emeka Oko, resounded the need for a coordinated healthcare system to accommodate the growing population that Nigeria is grappling with.
We want a situation where the healthcare providers themselves are patient advocates. Okay, one of the things I tell people is that Douglas Emeka Oko, when he advocates for healthcare, he advocates as a potential patient, not as a doctor. Okay, and that makes someone like me very objective.
United Nations representative Dr. Yusuf Suberu believes cases requiring neurosurgeon intervention can greatly reduce if human behaviors such as overspeeding and misuse of substance are put in check.
United Nations is committed in reducing accident by 50% on our road between 2021 to 2030. This is the decade we are working on. But we need everybody to come together to be able to achieve this purpose. Your life is very precious. My life is very precious. And one of the things that makes me talk more about human factor is that sometimes you can be driving very well and somebody else is not driving very well, and that person will just come and collide with you. With every good information you have within yourself has been wasted because somebody has refused to abide with the rules and regulations.
These collective voices, that said, underline the urgency of addressing healthcare challenges comprehensively and implementing measures to elevate the strain of neurological healthcare emergencies in the nation.